So talking to a podiatrist, I would be remiss if I didn't ask you, what shoes are you wearing today?
Today I'm wearing my favorite shoe, which is called a Hoka. H-O-K, and then did this show up in the thing there?
All right.
This is my Hoka. I like bright colors, in case you didn't tell. Hokas I love, that's my favorite shoe for me, personally.
Today we're going to be talking to Dr. Dan Bangart from Peoria Foot and Ankle. He is a podiatrist, which means they focus on the feet, ankles, and anything below the knee. Having him on the show is something we're really excited about because we've known him for a very long time. He's done amazing things for a lot of our patients that needed work on their feet and ankles. In today's show, we cover a lot of really fun topics, including, what running shoe to wear, but more importantly, how your foundation in your feet can have such a great impact on the rest of your body. It's so important to take care of your feet. You're on your feet almost every single day. And this is going to be really interesting for anybody who's ever asked the question of, should I see a podiatrist? All right, so today we're here with Dr. Dan Bangart. Dan, thank you so much for being here, Dr. Bangart, I should say. So first off, you are a podiatrist, right?
Correct, yes.
How long have you been in practice?
34 years.
34 years. What's that been like?
It's been a interesting experience. Ups and downs. There's kind of a flow to medicine where it just kind of, you have some good years and you have bad years, and good years, bad years. You adapt and survive. That's kind of how I've been
the truth about healthcare. You adapt and survive.
Adapt and survive.
So let's talk a little bit about podiatry,
okay.
Right? So in healthcare, one of the things we talk about a lot is the fact that when somebody has an issue, it can be really confusing who I go to, right? Do I go to a surgeon? Do I go to my primary care? What is a podiatrist versus a pediatrician versus all these different things? So first off, what is a podiatrist? And let's go through kind of what you guys do. What are the common misconceptions about podiatry?
Okay. So podiatrists are specialists in feet and ankles. Our license is below the knee, sure. Down to the toe.
So anything below the knee.
Anything below the knee, that's our area of expertise. And I think some misconceptions, podiatrists only work on toes or only work on feet, but we do ankle implants, we do tendon transfers, we do everything that's related to the lower extremity below the knee, both surgically and conservatively. And podiatry we're all trained in surgery these days, but really people only come and see me if it hurts when they walk. And that's really, if it's hurting when you walk, we're probably the guys you want to see. And our goal is to make you not hurt when you walk as simply and cheaply, if you will, as possible. And that's kind of the philosophy of podiatry. We're also heavily involved in wound care and limb salvage. Before we had podiatry, in a major impact in medicine, we had a lot more amputations. And so our goal is to prevent amputations, and we've been very successful. I think it's like a 70% reduction in below the knee amputations with podiatry involved in wound care. Yeah.
So what? Because I know oftentimes we hear people don't really know what goes into the education of different specialties. So what's the education of a podiatrist look like?
So education podiatry, you go to high school and then you go into undergrad, and you have to specialize in undergrad in a lot of science courses and things that
similar to pre-med.
Normal to a physician, and then podiatry school is very similar to medical school. In fact, most podiatry schools are associated with medical schools, and the first 2 years are basically identical classes, only we do a little more anatomy during that time. And then the last 2 years, when the regular family doctors are going out and they're doing pediatrics and OB and derm and whatever, we start specializing in feet even then. And so we'll do anatomy of lower extremity, and we'll go to foot clinics and start specializing in surgery. We still do some general education things, like during my time I was working at a dermatology clinic, I was working in a ER, working up heart attacks. I mean, so our training is very similar to an MD. It's only when they start subspecializing, we start focusing on
You
feet.
just focus more and more on the foot, where they're having to get a breadth of, they have to learn all the different specialties before they actually specialize in their specialty.
Correct.
From day one, you are just going straight towards that lower extremity.
And then how the rest of the body affects that. So we're concerned about vascular and neurological symptoms, things like that. But our focus is really on the lower extremity, rather than, like I say, in regular medicine, they'll spend that last 2 years getting a broad brush of everything, and then they decide during the residency what they want to specialize in. In podiatry, you already have 2 years of pretty specialized training. Then you do 3 years of residency. After
So you do have a residency as well?
Correct, for 3 years of residency.
Okay.
And during residency, it varies. There's typically a year of general medicine type things where, like my son who did his residency in county here, he was in the burn unit for 3 months.
Oh, wow.
Working on burn victims. My other son did his residency in Indiana. He spent a year on orthopedic trauma.
So we need to pull back for a second. So you just mentioned two different sons. How many people in your family are actually in podiatry?
Well, I have 2 sons that are in podiatry with me.
Okay.
And we practice in the same
Any
office.
other family members in healthcare at all?
No, just hair care.
Okay. So
2 daughters that aren't.
It seems like for you, podiatry's been a big part of your life with both of your sons in podiatry. What's the first thing that got you interested in podiatry? Of all the different healthcare specialties, why podiatry?
Well, I kind of fell into it. I was led to it. It was just more dumb luck than anything, I think. I went to medical school later in life, and I was finishing up, and I started applying to medical schools at the end of my 3rd year because you don't have to have a degree to go to medical school. And I had a family and 3 kids, and I wanted to get going. And so I applied to a bunch of medical schools, and I was accepted on a wait list in Wisconsin. And but everybody else was saying, not yet. My grades were pretty good. My MCAT was good. And then we were having dinner with a friend. He says, have you looked at podiatry? And I said, well, not really. He goes, well, I have 2 friends that are podiatrists, and they do really well. He started talking to me about it, and like this light bulb moment you get. It's like, that sounds really interesting. So I started checking into it, and this was April 6th in that year. And so I called a couple podiatry schools. I said, hey, I'm interested in getting an application. Well, sorry, our application closed April 1st. Oh, we do exceptions. Well, what's your GPA? And I told him, what's your MCAT score? And I told him, I said, we'll send you an application.
That's awesome.
And so they sent me an application, I got interviewed and got accepted. And so we went to San Francisco for medical school.
I think that's a good application for life, though, of people will tell you that there's rules, you can't do this, you can't do this, and it's usually the people that just persist past those obstacles that have success in life. So being able to say, hey, do you make exceptions and keep pushing forward? So that's pretty awesome. So let's talk about, as far as patients go, what are some of the most common conditions that you as a podiatrist are going to see?
So in a 40 patient day, which is a typical day, probably 10 of those patients will have some type of toenail issue, whether they're a deformed nail, painful nail. We do what's called routine diabetic care for patients. And then another 10 of those will be some type of digital, meaning their toes are a bunion, hammer toes, things like that. They're a problem. And then we'll have another 5 of those will be some type of a wound or ulceration. We'll have another 5 that are heel pain. The other 10 will be an assortment of dermatitis and nerve pain and walking problems and leg pain, things like that. So it's just kind of a variety of those type of things.
So you mentioned before that there used to be a lot more amputations before podiatry really grew as a specialty. So obviously you deal with a lot of diabetic patients.
We do.
So with diabetic patients, what are some of the most common things that they need to watch out for? So
diabetes affects multi-systems, but the 3 main things that you have to watch for are eyes, kidneys, and nerves. Mm-hmm. Diabetics typically develop neuropathy or numbness in their feet. And so when you have numbness and don't have nerves, your early warning system is gone. And so they're the kind of people that will walk around, get a blister and not feel it, and later that day they see blood on the floor and they're going, what's that from? And so because they're not having pain, they just kind of ignore things longer than they should. And so part of educating diabetic is just to realize that your early warning system's not working. You have to start using your eyes and your hands. You have to be more diligent in evaluating your feet. You'd never wear a brand new pair of shoes the first day all day. You check during the day, and just simple things like that. And then daily inspections of your feet, both visually and with your hands, to make sure you haven't stepped on a toothpick, which I had one patient do, and had a toothpick in his foot for 2 days, didn't know it.
Wow.
So just being more aware of their feet, realizing their nerves aren't giving them the signals they should, and they have to be smarter about it. And that early prevention is worth many, many pounds of cure.
Absolutely. We work with a lot of diabetic patients, but more on the pain side. And that's one of the things that we see is, like, as soon as somebody starts to get diabetes, numbness, tingling, burning, could be sharp pains, shooting pains is kind of how it's described to us. but there's so many different complications that can come from people with diabetes. And you mentioned, like, with that numbness, sores, and obviously amputations when those get out of control and things like that. Having a toothpick in your foot for 2 days definitely can lead to a lot of complications. But one of the things we see is as soon as you have that numbness, you go up for, pretty drastically as a fall risk, right? Because you can't feel your feet as well. They tend to slap their feet a little bit more, trying to get more sensation. Where do you see the pain come in diabetic neuropathy? So painful diabetic neuropathy, obviously the condition. How do you guys treat that? What do you do for it?
So neuropathy is not always painful. Sometimes it is. Sometimes it's just a straight numbness, like you say. And there's sensory nerves on the skin, but there's also nerves at the bone level. Mm-hmm. And so even though sometimes your skin is numb, the deeper nerves are intact, so they still have what's called proprioception. They know where they are. And so they're not stumbling that much. Mm-hmm. When it gets to the point where they can't know where they are, that's a real problem. When they start becoming painful, that's a much more difficult problem to deal with, obviously, because not only they have numb feet, they have numb feet that hurt, which is kind of an oxymoron, right? My foot's numb, but it hurts. Mm-hmm. And that has to do with those different layers of nerves. I think that even though they're numb, those deeper nerves, you can still get a fracture that will hurt mm-hmm. in a diabetic because bone is highly innervated. And so I think that's why they have numb feet that hurt. And that becomes a greater challenge of treating those people. So we've tried medications. There's mm-hmm. specific medications we've tried over the years that are moderately successful. Some people people are individual. Some people respond really well, and then the next person, no response at all, right? Absolutely. And then we'll look at, there's supplements that help regenerate nerves sometimes, and then also we're often looking at some type of nerve stimulators to help with that pain. That's been very successful at helping the really severe diabetic neuropathies. Yeah, with the new technologies and the advancements with that technology, it's been pretty amazing to see how neuromodulation, what you're talking about, has absolutely transformed. Where it used to be, there's not much we can do for them, and now it's actually decreasing that pain, gets people mobile, gets people active. I've been really impressed with that technology as well. Oh yeah, it used to be 30 years ago. Oh, bummer, right? I'm sorry.
Live with it, right?
Yeah, pick your parents more carefully, right? And keep your blood sugar under control, things like that. But other than some narcotics and some medications that have a lot of side effects, there wasn't a lot to offer them. Now with the newer technologies, it's just we can help. Here's a list of things we can try, from simple to more complex, and it's much better. So I'm going to switch directions on you for a moment. So, let's say we talked about class of patients that are pretty sick that may come to see you. Let's talk about maybe some people that are more healthy, active, stuff like that. Is there a preventative type of care that podiatrists do? Like, I know people go to the dentist every, 6 months they're supposed to go to the dentist, and they get preventative care, and then you're supposed to go to your primary care a certain amount of times. Chiropractic obviously loves to do some of that maintenance stuff. For podiatry, if you're healthy, why are some reasons you might want to see a podiatrist? Unless people hurt when they walk, we pretty much take our feet for granted mm-hmm. until they start to hurt, and then we get mad at them for letting us down, right? And so, if you have a family history of foot problems, if you look down, even though it doesn't hurt, you start seeing some, maybe your toes are just not looking like they should. But for the most part, pain is the major indicator that people come in. I think when I first started in medical school almost 40 years ago, only 3% of people used podiatry services. Wow. And now it's probably 50%, right?
Wow.
Just
That's
that in that lifetime.
Increase.
Dentists have done a great job of educating. You got to get your teeth cleaned every 6 months, at least yearly, right?
Mm-hmm.
Or it's not good, right? I think for most people, if their feet don't hurt, and they're not having any problems, unless you're diabetic or have a systemic situation, we're not probably on your list of yearly needs. Yeah, so not a lot of maintenance necessarily, but let's talk about, so my wife's a big runner. When I was growing up, I had arch issues. There's a phrase called, people like to call flat feet, which I know you have something to say about that. But what's going on with that? How can that affect the rest of the body? Why do flat feet happen? So the flat foot is more what we call a flexible foot, and it doesn't function well mechanically. And so when you have poor function mechanically, a lot more adaptation is needed, a lot more muscle activity, a lot more stress on joints. And so It's kind of like you drive around with your tires out of alignment. We've all done it, right? Pretty soon our tires are wearing out too soon. And so when you have a flexible foot, it's like things aren't aligned well, and so things tend to break down more quickly. And so a lot of times people just adapt, they just start doing less, right? People with really flexible feet don't make great sprinters. They don't like to be on their feet that much, so they become your, people that have, telemarketers and accountants and things like that don't have to be on your feet a lot. So you kind of naturally think adapt to that sometimes. But people like to run. We live in a world of cement, and so in Phoenix area, a lot more heel pain and bone pain, things like that. My son, who did his training in the Midwest, where there's more dirt and wood floors, much different problems we see here than they see back in that area, just because of the type of ground we're walking on. So in the world of cement, we need some help sometimes. So proper shoe gear is really important. Sometimes we recommend orthotics for those flexible feet. Think of orthotics like eyeglasses for your feet. People don't wear glasses because they love them. They wear them because we see better. And so with orthotics, they make your feet function better and can just kind of align things back so they don't wear out as quick. And so if you have a family history of flat feet or flexible feet, or a family history of any type of digital deformity, those are the kind of people that probably should come and be seen. For example, if you have bunions in your family, a bunion is where your big toe just goes the wrong direction. You aren't born with those, but they come on over time. So what you really inherit is a foot that's prone to developing that. If we catch that early, we can prevent you from having that deformity.
So how would you prevent that?
So basically you have to control the mechanics of the foot. So as it's like with a car, you're going to get your tires aligned. Every couple of years you have that alignment done. With feet, we watch them walk, we see what's going on, and then if we see those indications of poor mechanics, a simple orthotic can be very helpful. There's also little implants we now put in the hind foot that realigns the foot intrinsically. It's kind of like having LASIKs rather than eyeglasses. So a number of things we can do to be preventative maintenance for people that have that family history of bunions or other deformities that you should probably have checked out.
So let's talk about orthotics, because I know that I feel like every running store, they have like Dr. Schultz insoles and the Are You Gelin type thing that was like a huge campaign that they did. What is an orthotic supposed to do, and what's the difference between an orthotic you may buy at the store versus one you'd get from a podiatrist?
So orthotics, typically, the real term in orthotic is a prescription device made specifically for you to control a specific part of what your foot's doing. That's kind of gotten stolen. Now these shoe inserts that we buy, the arch supports, have now gotten that title of orthotics as well. And but if it's not custom, it's more of an arch support. But some people, that's all they need. And some people wear over-the-counter glasses for a few little things. Some people need prescription glasses. Same thing with feet. Sometimes those over-the-counter devices, and there's 100 of them out there at least, can be helpful. For some people, it's all they need, and there's nothing wrong with those. A true orthotic, though, is going to control your foot, not just cushion it. So the arch supports you see in the store are more for cushioning. They're trying to just kind of make you feel a little bit better, just stop that last few degrees of motion that hurt. So they can alleviate pain, give you a little bit of cushion, but they're not going to control the mechanics of your foot as well as a prescription device would.
So let's say you're a heavy runner. You get into running, you start running. I guess two questions there. One is there something you should do? Should you look at an orthotic if you're going to get into running? Or do you wait until you start seeing my feet are starting to hurt and then go in and see a podiatrist?
I think if you really want to start running, and I think the running stores will promote this too, the better running stores, they're into big time into inserts now. They're not custom, but they're getting better all the time. So they're going to look at your foot. They're going to tell if you're an overpronator or an underpronator. People with high arch feet have issues with shock absorption. And so they're going to require a different type of shoe than a person with a more flexible foot that need more support. And so the newer running stores are very good at identifying that and helping you get an idea. And then, and so sometimes just those little ones they sell for less money can be helpful for you. But the proper shoe is important. Once again, if you have a family history of foot problems, or if you really want to be really careful, seeing a podiatrist about your foot, getting X-rays, having a gait exam, range of motion exam can be very helpful at determining what type of foot you have and what type of problem you need to look for.
So talking to a podiatrist, I would be remiss if I didn't ask you, what shoes are you wearing today?
Well, I'm glad you asked, Justin. Today I'm wearing my favorite shoe, which is called a Hoka. H-O-K, and then did this show up in the thing there?
All right.
This is my Hoka. I like bright colors, in case you didn't tell. Hokas I love. That's my favorite shoe for me, personally. I have a fairly high arch foot. Shock absorption is my issue. So people that have to stand a lot, my dock workers, my nurses, delivery people, love Hokas. You know, you work at Amazon, you want Hokas. Trail runners, I would probably steer them more towards a Brooks, a little more stable. Some of the Hokas have a trail shoe as well. So Hokas started out as a really cushiony kind of shoe, but they've evolved a little bit. So there's some good trail shoes Hoka has. A lot of marathon runners are using Hokas these days. I had one that said, shave 5 minutes off my time, just changing shoes. So Hoka's my favorite. Brooks are my second favorite. Guess what the worst shoe in the world is?
Okay, so I'm going to guess that flat shoe, but Converse?
Converse is probably the worst designed shoe in the world. In the early 80s, before Michael Jordan came out, that was the shoe of the NBA. Terrible shoe as far as function. And then the second worst is Vans. What are the two most popular shoes with teenagers?
Converse and Vans.
Vans, right? In fact, I had a patient the other day, and they came in, and mom had Vans, the kid had Converse, and their feet hurt. You know, I go, well, we can probably help that.
Let's get a better shoe.
Get a better shoe.
Follow-up question on this one. What should people look for in a shoe? You just talked about how Hokas are your favorite, and they're good for certain people. Brooks are maybe better for other people. And there's obviously massive amount of different shoes out there. If someone's trying to decide on what type of shoe would they pick, Dr. Dan Bangart's shoe recommendation, what should they look for?
I would start with the Hoka. That's my go-to shoe. And the people that, so REI is really good. There's a place called the Tortoise and Hare over by us. These people that specialize in running shoes, they're really, really good at helping you fit and find that shoe that's best for you. So I'll send somebody in for a Hoka, and before they leave, they might end up with a Brook or a certain type of New Balance, depending on their issues.
Why would they switch? Like, what is it? What are the characteristics that are most important to look for in a shoe?
Well, first of all, it's got to be comfortable.
Okay, that's the most
Number
important.
one, comfort. Number two, you got to like how it looks, right? These days, and so
not going to wear it if you don't like how it looks.
And it's got to do what it wanted to do. What's your activity? Are you going to stand, walk, run, hike? Those type of things. So the activity, so comfort, looks, and activity level. And so once again, I like the people I send to the Tortoise and Hare. I know they're going to help me there. They're going to do a good job of identifying the best shoe for that person. Even though I think I like this shoe for them, by the time they watch them walk and they have a little thing, they have them scan their feet, and so they really help specialize that and help me out too.
So you're saying that picking the right shoe can oftentimes change whether you have foot pain or not.
Correct, absolutely.
Not to mention make you run faster.
And
so those commercials
higher, right?
by Nike are real, to where they're saying make you perform like an athlete. Like a shoe can make a difference.
They definitely can.
I think that's awesome. So going back to, so obviously we deal with a lot of patients in pain. And you deal with a lot of patients in pain, because you said like a lot of people,
right?
Most people don't go to a podiatrist unless they have pain. So just talking a little bit about the collaboration you do with pain doctors and stuff like that, when do you normally see that, you're from the knee down, when do you see, or what types of patients do you see that normally need to go to a pain doctor? So
those are the patients that have really bad, severe peripheral neuropathy. They have painful feet that's really coming from above the area. It's not a foot problem, it's a nerve problem. Right. And often they might have a bad back. The nerves that come to the foot are L4, L5, S1, which is low back, which is probably 90% of back pain, right, in our society. And so if you have a pinched nerve in your back, it can radiate pain down to your foot. And it's kind of like you bang your elbow, your fingers tingle, right? It's not the fingers, it's the nerve going to the fingers. Analogy. So we call that radiculopathy, that radiating pain. But the other thing is, if you have an impingement in your lower back, when that nerve root is affected, the rest of the nerve is more sensitive. It's kind of like when you have a sunburn, a little slap hurts. When you have a nerve impingement, the whole rest of that nerve is much more easily irritated. And so my diagnosis, if you say your foot hurts, if I can't reproduce the pain in your foot, then it's probably radiculopathy. If I can reproduce the pain, then it's either your foot or a combination of those things. And so when it's not in the foot and coming from above, that's when I involve the specialist in pain.
You know, the one other thing that we've seen is obviously there's a lot of times that we as a pain group will send to podiatry because of that extreme specialty in below the knees, whether it's surgery or pain or different conditions. But I want to talk about as well, like what happens with the foot, how that affects the knee, the hip, and the back. Can you speak to that for a moment?
I can. So your foot is when you come down and bring your foot hits the ground, it's the great mobile adapter. We can walk on slanted roofs, we can walk on grass, dirt, rocks, pavement. Our foot is very adaptable at doing that. And then the problem comes when we exceed that ability to adapt. And so once it adapts, then it also is able to reposition itself, so it's nice and strong for propulsion. And the other thing that it does is it absorbs rotation motion. When we walk, it's a lot of rotation, hips and knees and all that. Your foot is designed to absorb that rotation motion, so the rest of your body doesn't. When your foot, for example, overpronates, it gets locked over in that pronated position. It can't come back, and so that rotation motion gets passed up. It'll hit the medial knee. The knee starts rotating, and then once that happens, you start compensating with more muscles in the hip and leg, and so pretty soon your low back's affected. And so when your foundation is not good in a house, right, the roof sags, the doors don't open, same thing in the body. If your foundation is not good, then nothing above it becomes a player in that.
And that's exactly what I was getting at, is sometimes we are going to see issues in the back that are causing pain in the feet, like you talked about. With neuropathy and all those issues, you've got an L4, L5S1 issue. With those nerves, as they go down to the foot, you're going to feel a lot of foot pain, numbness, tingling, but it's coming from your low back. But vice versa, you could have feet issues that change gait, which is the way you walk, and biomechanically now are causing back pain, and people will do all sorts of stuff for your back, when in reality, we need to get your foundation or your feet fixed, whether that's, arch support with an orthotic or different things like that, that now get that rotation out of the knee, get that rotation out of the hip, get those muscles to relax in your back. And it's like, we have people that come in and they say, I finally got like arch support and my back pain went away. And I think it's pretty amazing how important that is if you have back pain, going to a doctor who works with that needs to work with different specialties like podiatry to say, you know what, it could be the back. Absolutely, that's where it hurts. Let's look there first. But then being able to say what other specialties and what other people, and working together as a team to make sure the patient gets where they need to. And podiatry, again, your foundation is so important to your whole health. You stand on your feet all day, you walk around, you do those things. If you don't take care of your feet, don't be surprised if you have knee issues, hip issues, back issues, neck issues, because it's going to affect everything above that. So I just love the analogies that you've used there and how important that is for patients to understand. There's that old song, the knee bone's connected to the hip bone. Like, it absolutely is true that if we don't take care of our feet, we're going to have issues up the line.
Absolutely. And sometimes specialties become hyper-focused on our area, right?
Mm-hmm.
And it's so important to me when I'm able to watch my patient walk in, because you pick up so much just watching them walk. If you walk in, they're already sitting in the chair, it's like, my toe hurts or whatever, and you talk about that, but until you actually see them walk, and then it really helps to, help you understand exactly what's going on. And so I'm sure, chiropractors, they'll focus on that. We'll make that adjustment and we'll keep working on that. But unless you watch them walk and see how they move, it really then helps open your eyes and realize you need more help.
Okay, I'm going to shift gears again on us. So as far as technology, we talked about this a little bit at the beginning. Like, we're seeing these huge advancements in technology. Medicine is getting better. Side effects are getting less when it's done properly as we see technology advancing. Is there a certain technology or procedure or something going on in podiatry that you're really excited about that maybe the rest of the world necessarily doesn't know what's going on yet?
There is. In fact, I just had a meeting today about that with a representative from that. So for years we've had nerve stimulator for the back. It's like a pacemaker for your back. It just helps that general back pain, can also help neuropathy pain. We now have what's called peripheral nerve stimulators, and we can then isolate that. For example, I have a patient now that has what we call tarsal tunnel. Not wrist, we have carpal tunnel, but we have tarsal tunnel. And so they have this tarsal tunnel pain that sometimes you try to get it better. We try lots of different things. Just like for carpal tunnel, we put them in a brace, and we'll try injections, we'll try medications, and it doesn't work, and they end up having surgery. And feet are harder to heal than hands because we walk on our feet, right? And
Can't stay off your feet very
our
easily.
goal in the foot is if we can avoid surgery, we always like to do that because surgery, even though it can be successful, can also not be successful.
Yeah.
And so with the nerve stimulators now, it's a very non-invasive procedure that can eliminate a lot of that local nerve entrapment pain that we're treating all the time in the feet. Like I say, on an average day, I might see 10 people with some type of nerve entrapment or nerve problem. That a lot of times responds to some injection therapy or certain modalities, but some can be really resistant and tough. So these nerve stimulators for the periphery are just really a great technology. It's going to be very helpful moving forward.
Yeah, and I don't think a lot of people know that. And so other things that I've heard with the peripheral nerve stimulation is, if you had a ankle surgery, if you had like a crush injury where your foot's been ran over your ankle, you broke your ankle, one of the things that happens is they'll go in and they'll do surgery. Well, when you do surgery, you have to make certain cuts, you have to cut through tissue, you have to do stuff, and you can fix the biomechanical issue, but sometimes those nerves don't fully heal properly, and if they don't heal, they're saying there's pain, there's pain, there's pain, even though there's not, and being able to use that peripheral nerve stimulation, which actually just calms down that painful nerve signal, it can really bring back a lot of function, get you moving again, and it's technology like this that gets me really excited as well as being able to say, for so long, like one of the treatments that was so common was, if you're in pain, just take a pill for it, it's easy. But the problem is that's how come we have an opioid epidemic of 100,000 people dying every year. And as we've seen technology get better, we can be so much less reliant on just treating the symptoms and instead go to, let's go a different route on this. Let's find what the root cause of this is and see what we can do to actually bring relief, but more importantly, restore function. And so I love that you picked that one to share because that's one that obviously we do a lot of research on as well and find that one to be fascinating. Okay.
Yeah, the problem with the pill is pretty soon you need 2 pills. I need 4 pills. I remember watching Brett Favre became addicted to opioids. He was taking 10 or 12 pills at a time.
Can you believe that? Oh,
I know. It would kill the normal person, but your body just adapts to that. And so having non-narcotic ways to treat pain and it's just so much better for people's lifestyles, because, most people, when they take narcotics, they don't like the way they feel. And they create lots of other problems as well. So nerve stimulators and peripheral, both back and periphery, are just the cutting edge, I think, of what we can do to help people.
And the thing is about that technology is it progresses so fast. I mean, look at your phone. 10 years ago, what did your phone look like? If you had an iPhone, like what version were we on back then? I don't know, iPhone like 5 or something like that, right?
Right, yeah.
And then you look at what they can do back then compared to what they can do now. And as that technology is advancing, I just feel like we're going to see more and more utilization to where we can help patients get the relief they need. And I think that's something for us that's really important is it's not just about getting people out of pain. It's about restoring the life they want to live, right?
Yeah.
When people can't walk, massively impactful to their quality of life. They can't go out with their friends, they can't do their chores around the house, they can't do whatever they want because they can't walk. And so function and improvement of daily function is something that obviously podiatry has a huge impact on. As pain, as our group, this is something that's super important for us is restoration of function. So we talked about education, we've talked about kind of patients, we've talked about some of the technology. What's one of the most common, either misconceptions or things maybe that people don't know about podiatrists that would be useful for people to know?
I think people understand the scope of our practice. I think some people, before podiatry, it was called chiropody.
Chiropody?
Chiropody.
That's something I didn't know.
Yeah. And podiatry really became a profession in 1950.
Wow.
Before that, we was just chiropodists, and they just basically did corns and calluses, trim toenails, and those kind of basic foot care. And so I think some people still think that's all we do is trim toenails and trim corns. But like I say, we do total ankle replacements. We do tendon transfers. We treat wounds. Just the scope is just, expanded.
Wow.
And podiatry does, so in medicine we have what's called a CPT code, which is a procedure code. And podiatry does 80% of the foot codes in this country. Orthopedists do another 10, and another specialty do a few here and there. But basically any procedure on the foot, podiatrists are 80% of these days.
So podiatry in general, you're a foot and ankle specialist then,
Correct.
Is that accurate?
That's correct.
Oh, you learn something new every day on that.
There you go.
So chiropody, that's one that I have to say I had no idea. Okay, so with that then, what's going on in your life, your practice? what's something that you'd want people to know about you?
Basically, as I mentioned before, people only come because they hurt when they walk.
Mm-hmm.
And our goal is to make them not hurt when they walk as simply as possible. And so it's just that type of, we like to think of our patients as our friends. We like to treat them like we like to be treated, right? And you mentioned lifestyle and things like that. Someone will come in, I have a lady's 80 years old. She has a pretty good bunion. She goes, do I need to fix my bunion? And I say, well, does it hurt? No. Does it keep you from doing the things you want to do? No. Then why would we fix that, right? Yes, it hurts. Yes, I can't. Well, then we should probably fix that. And so you just have to be sensitive to people's needs and what they need. And some people, orthopedic surgeons, for example, they're trained surgically. If you see an orthopedic surgeon, he's going to think about, how can I fix this surgically? It's just his mindset. It's just his training. And there's nothing wrong with that. It's just how he does things. But I get lots of refugees from orthopedic surgeons that come in, my foot hurts and they want to do this surgery on me. And I go, well, what's going on? Well, and we find out it's just a simple nerve entrapment. We treat the nerve entrapment, their pain's gone, and they didn't have to have surgery.
Wow.
And so it's just having that approach where we're not focused just on surgery. We like to, here's your options.
Is that unique to you guys, or is that across all podiatry?
No. Unfortunately, there's a lot of podiatrists that they just think, I need to do surgery. I'm a surgeon. I'm trained to do surgery. And, so my philosophy for a long time has been that, get you better as simply as possible. Mm-hmm. Surgery is an option, but if we don't have to do surgery, if I didn't need surgery, I wouldn't want to have surgery.
Yeah,
right?
That makes sense.
And so if you don't need it, I don't want to give it to you either. So sometimes surgery is important, sometimes it's not. And so once again, just understanding the patient and having that approach where, what can we do to get you better that's best for you? Mm-hmm. And typically when a person comes in, I say, hey, we have 2 or 3 options. We do this, this, or this. What works best for you?
What fits your lifestyle?
What fits your lifestyle? What fits your personality? There's 4 different basic personality types, right? And some people just fix it. Don't tell me what you're going to do. Just let me know when it's done,
Get it
right?
done.
And some people, they want to know every detail. They want to know what kind of screw you're using, what type of blade you're using. They
What's
want to know
the material
every detail,
of the screw?
every
everything.
detail, right? And so it's understanding those people and you try to address those concerns in them and teach them, here's our options, 1, 2, or 3, good, better, best, or they're all the same. There's really not a bad choice here. What do you want me to do for you?
I love that. Like, as doctors, I feel like it's one of the most underrated skills is actually listening, not telling.
Yeah.
Right? I think it's so important that when a patient comes in, one of the best things you can do is just take the time to listen and then adapt your care to meet their needs, because so many people like to do this cookie cutter medicine, right? Of like, you have this, we're doing that. You have this, we're doing that. And where I see the best doctors is they sit down, they listen to their patients, they see what do you need, and then let's match the type of care to help you achieve your goals. And it sounds like you're doing that, which is amazing, because I think that's where you see patients not only get better, but they end up loving their doctor. They refer their friends to their doctor because of that experience of, I had a doctor who listened.
People know their bodies, and you got to listen to them, what they're saying. And one of my financial consultants, he ruptured a tendon in his foot. And he lives clear in Scottsdale. I said, I'm going to go, it's just too far to drive. I'm going to go see this guy. And so the guy looked at him and said, okay, we need to do this. He had like 5 surgeries we need to do to fix your foot. We're going to cut this bone, move this bone, shift this bone, do this, all this stuff. And he called me and asked me what I thought about that. And well, let's see, you're 72. That's a lot of surgery.
It's a lot of surgery.
And what did he say when he looked at your foot? Well, he never looked at my foot. He looked at my x-rays. Oh, well, that's a lot of surgery. We can probably get you better without doing all those different types of surgeries. And because the problem is your other foot's very similar to that. You do that to this foot, you're going to have to do that to the other foot later. Your feet are going to be so asymmetrical. So he came in and we just repaired his tendon, put an implant in to stabilize his foot, and he's done great.
That's awesome.
And so, yeah, you got to look at, you can't treat x-rays, you got to treat people, and you got to look at their life and what they're doing. And his goal is to be able to walk his dog. He didn't want to be a high jumper, right? He just needed to walk his dog and be out of pain. And so he's
I love
been pretty
that.
happy.
You can't treat x-rays, you got to treat people.
Yeah, you never look at your foot, you just look at your x-rays, and we can make your x-ray look better by doing this. And the x-ray would look great. I mean, those surgeons weren't wrong. I mean, he had the pathology, but a 7-year-old guy that walking his dog, it's just kind of a little bit more than I'd want to have.
Well, I think that's like the golden rule is true in medicine as well. Treat people how you want to be treated is not, don't treat based off of financially what's going to be good for you, but treat people how you want to be treated.
Oh, yeah.
And I think if more people practice that way, we'd have a lot less expensive healthcare, but we'd also have a lot better healthcare because it would lead to people achieving their goals and restoring function. And I think that's the most important thing.
Exactly.
Two last questions. Again, for everybody that's listening, name of your practice. Your group is such a great group. We love working with you guys. So Peoria Foot and Ankle, out in, you guys are on the west side, obviously.
Right,
Thunderbird, just off the
94th Avenue
right?
in Thunderbird, just off the 101.
And last question I have for you, okay? So if you weren't a podiatrist, what would you be?
I started out life in construction. I grew up on a ranch, the farm, and then we developed a family construction company. I'd probably still be doing construction. Building stuff is fun, and so I'd probably be doing something like that.
Sometimes it's not so different from what you're doing on rebuilding a foot or working on those and stuff like that.
I mean, a lot of the old story about everything I need to know I learned in kindergarten, right? How to cut and how to so a lot of times, running a screwdriver and running a wrench is, the surgical things we do are not that far. Bone is a lot like wood. You can cut it, angle it, put it back together. It's very similar to normal construction things.
Well, thank you so much for coming on today. It's such a pleasure every time we get together, I just love hearing kind of your thoughts on stuff. And hopefully our listeners get that benefit as well. So thanks for coming on. And
my pleasure.
I'm sure we'll talk some more.
All right. Thanks, Justin.
All right.
Have a good